This conference will now be recorded.
So we are very clear about all the medications produce teratogenicity, whether those medications can be prescribed one or OTC or newly approved drugs. The basic concept is very clear with us. It is only the probability which type of drug produces teratogenicity to what extent. Now, if you look at the concept, extrapolating towards the probable cause for birth defect, if we take the same drugs, prescribed drugs, in this case, the fact is very clear and established also. The fact is clear and established in the sense that you have a drug in your hand. If you know that it is probably cause birth defect, by administering the same drug for long period of time, say 1 week or maybe 1 month time, you're going to establish the concept that whether the drug produces the birth defect or not. So the fact around the prescribed drug is very clear about their ability to cause birth defect because they are continuously used. So prescribed drugs are continuously used for say minimum 7 days to maximum of 2 to 3 years, also sometimes whole lifetime. But the interesting fact is that whether the medicine that was taken for 1 week or 15 days caused birth defect in the woman of childbearing age. That is the fact. Now, with the prescribed drugs, the such facts are very clear because the drug is used continuously. So, X drug prescribed for and patient consumed it for 7 days, especially woman who is pregnant, the result is produced. So the relationship of birth defect and drug is straight, very straight and strong, right? Even the new drugs which are launched in the market after post marketing surveillance study, the fact is clear, right? Because new drugs are launched, but after some time they are continuously prescribed. So the concept with both prescribed drugs and new drugs is very clear because such drugs are administered for longer period of time. But the problem comes OTC medications, over the counter medications. We know that OTC medications also causes birth defect. We know that, but is it possible to link such effect with the drug is the only the fact which we need to understand it clearly and try to link it. Now, let us understand why there is a difficulty in understanding the birth defect caused by OTC medications. Ria Sara, why do you think that it is so difficult, or is it easy to relate it? Is it easy? Sorry,
to so it's easy to relate OTC medications to
can you be louder,
drug
please?
effects. So it's not easy to predict whether the OTC medications whether they cause any drug effects.
Why do you think that it is difficult?
Um, so sometimes the SAR studies that are done or the animal studies that are done, they may not give the exact results like how they might give on. I mean, like the results they give on animals may not be exactly like how it should be produced in humans. So,
Okay. Sherin Babu.
Yes, sir.
Yeah. Go
Uh,
ahead with.
Sir, OTC medications non we will not use every time only in special situations, certain conditions we will take. So we will not expect that some ADR will be causing by that OTC medications like that.
Okay. Good. Sai Srilekha.
Sir, it is difficult because everyone takes OTC medications without any prescription. In pregnant women, sometimes they may not tell their doctors that they are taking OTC medications, or they might not know that OTC medications are also uh, harmful for the fetus. So they might take, and they may not even say to the doctor like that.
Irene Sarah. Irene Sarah. Aparna.
So we are not taking OTC medications on a daily basis, unlike the prescribed drugs. So it is very difficult to establish that OTC drugs has caused any birth defect.
Okay. Nikita.
Yes, sir, maybe proper studies have not been conducted on OTC medication.
Mhm. Okay. Yes, here.
don't know, sir.
Okay. Tenzin.
Don't know, sir.
Merlin. Merlin Sarah.
Sir, as Sharon said, we don't expect adverse effects from OTC drugs and unable to distinguish between adverse effects of OTC drugs and other continuously taking drugs. Yeah.
Okay. Irene Sarah. Amal. Lakshmi. Safisha.
Sir, don't know, sir.
Kezia Rachel.
Don't know, sir.
Riya Pillai.
Sir, I don't know.
Yeah. Go ahead.
Sir, I don't know, sir.
Okay. Amal Jishnu. Anju Varki. Anne Maria.
So there is no proper way to take the OTC medications like as we follow for the
Hmm.
prescribed drugs.
Hmm.
Whenever we feel ill, we will go get the medicines and we will take. Whenever we feel better, we will stop that. So it's difficult to. We might think it won't cause any side effects for us because we will take it's like one or two like that. I don't know, sir, properly. I think.
Oh, no problem. Yeah. The reasons what you all quoted is perfectly right. The main problem why it is difficult to relate birth defect to drug is that we don't use it frequently as prescribed by the physician. So infrequent usage, say for example, woman may have headache in the morning, maybe she will take one dose of aspirin or maybe paracetamol and say that her headache has gone. So she so after that she would not have taken at all. So you cannot say that birth defect is caused because of such drug usage for only maybe for 1 or 2 times. And another important fact is that patient assumes that OTC medications are safe as they did not experience any other in other time, because whether the woman has taken the medicine earlier and now if she wants to take the same medication, now she will go with her experience, past experience, and she tries to equate that earlier no such effects are produced, now how the OTC medications can produce now. So this may be one of the reason, or they will listen to other classmates, I mean other friends or maybe relatives, and they get the information that it is unlikely to cause, so they assume. So patient assumes about the OTC medication that it is safe, it is safe. So that is how they take it, but you cannot say that that is because birth defect is because of that, or sometimes it may be also. So there's a highly confused state will be there. Here also a second assumption comes that prescribed medicines are safe. So as they did not cause any adverse reactions, prescribed medications are safe as they did not cause adverse reaction. So OTC medications are unlikely to produce any adverse reaction. See the presumption, how strong the people will be having it. One thing is that they go by the experience. A OTC medication taken before pregnancy did not produce any effect, so they presume that the same drug will not produce any effect now. This is one experience, either their own experience or the experience from the relatives or friends. The second possibility is that patients tend to assume strongly that the prescribed medicines are safe as they did not cause ADR. So OTC medications are unlikely to cause the problem. So because of these possibilities and assumptions, what happens, even though the OTC medication would have caused birth defect, it is very difficult to equate such birth defect because of OTC medications due to these following reasons. Now, in order to relate which drug was taken, whether it is really associated with the birth defect, what is the extent of evidence available, and how long such practice is done over a period of time or on a large number of population, the pharmacoepidemiology helps here. Okay, so pharmacoepidemiology helps in knowing drug usage and effect. This is what we have understood by the definition. So the effect here is that birth defect. Effect is birth defect, whether the birth defect is produced by what type of drug when it is used in large population. So this is where the pharmacoepidemiology helps to understand the drug usage and their effect in understanding the birth defect. So there is a possibility that OTC medications may produce the birth defect, but it is very difficult to establish the link, unlike prescribed drug or new drugs. I hope this concept is clear. Anybody is having any doubt? Shall we move on to the next part of it?
Yes, sir.
Yeah.
Yeah.
Now we know that there are problems, like the way we have understood now, how difficult it is to relate the birth defect with the drug. So far, and also we know pharmacoepidemiology helps in this assessment. So next part which we are going to understand is that how pharmacoepidemiological research helps in addressing the clinical problems associated with the drug, right? So there are two facts which usually goes generally whenever you want to uh, prevent the patient getting affected by the drugs. Very broad concept, general concept. If it is used, there is no room for presumptions or assumptions, right, and confusions. First fact is that avoid pregnancy when drugs with teratogenic potential are taken or administered. Okay, the simplest concept is that no need to plan for pregnancy when you are taking the medicines which have got teratogenic potential or ability, or while taking medicines, if the woman becomes pregnant, then it is better to terminate the pregnancy. It is better to terminate the pregnancy if it occurs while taking the medicines. So using such general concept always helps to relate or to protect the growing fetus from the effect of uh, drug. But it is not so easy to uh, follow such kind of rules because of our emotional attachments uh, we have. So in spite of this, what to do, how the pharmacoepidemiological research can be used in order to address the clinical issues which come across during such situations. Okay. So first concept is that, so whenever you like to use the drugs that are known to be teratogenic, now what to do in such case? What to do in such case is the main question. So now, before we understand the drugs with teratogenic effect, let us understand what you know something about it. It is a general concept, just to extend your opinion, that's all. Whatever you feel, the right answer, you can tell. No need to, fear about wrong answer. There's no need of that. Sai Srilekha.
Yes, sir.
Question is, all drugs produces, let us say that you have drugs, you have a drug
Hello.
that produces
Yes,
teratogenic
sir.
effect. Now, what is that you would like to confirm about that teratogenic effect?
Sir, I couldn't hear anything. Sir, can you please repeat again? We have like there is a teratogenic drugs, and how can I confirm? Is that the question? Because of network issue, maybe it was breaking. The
Yeah,
voice was breaking.
what is that you first mute. You mute, listen to my question, then you can answer them. The question is that you have a medicine with teratogenic potential. Now the situation is that you need to take the medication. What is that you like to understand about the drug? This is the situation and question.
Sir, we can switch to some other drugs, sir, instead of using teratogen. When we know it is teratogenic, it's better we can switch, no, sir.
Let us say that you have alternative drug that also produces the teratogenic effect. You have alternative drug that also produces teratogenic effect. Now you go with your answer now.
In that case, then termination of pregnancy will be better, I think, sir.
Riya Sara?
Yes, sir.
Yes, go ahead with.
So when so it's better not to take these tetratogenic drugs while the person is planning for a pregnancy.
Now, suppose if you are told to take it, then what do you do? What is that you like to get the information? Suppose.
Uh, so if it's causing a birth defect, then the doctor won't prescribe it, right?
In case if it is required, I'm telling you, do not diplomatic answer. One is right answer. In case if you want to take the medicine, okay. I'm
Yes, sir.
giving you the possible situation. That's all. No such situation should not arise. I hope so.
Yes,
Strongly.
sir.
Okay. If it is, then what is that you like to understand? This is what my question is that.
So I don't know.
Okay. Ria Pillai.
Sir, replacing it with another drug of same action.
Sorry, can you repeat it?
We can replace it with
Some audio problem is there. Okay. Navindran. Sorry, Nikita. Ria Pillai, you can type and send a message. Not a problem. Nikita Vikram.
I don't know, sir.
Navindran. Marlin Sarah.
don't know, sir.
Megha.
Sir, I may ask how does it affect, and also I may ask if there is any other drug which can reduce the effect of this.
Okay. I will tell you the another possibility where there is no antidote available as you're expecting. Alternative drug is available, but it also has teratogenic effect. Now, which one do you prefer?
I prefer not to take the drug.
Okay. Lakshmi,
I don't know, sir.
Kezia Rachel, Kezia Kurian,
Don't know, sir.
J.
Don't know, sir.
Atira,
So, I'll ask the doctor whether can I not take the medication till the pregnancy is over? Like whether can I do that or something like that, sir?
okay. Aquina,
Don't know, sir.
Aparna,
So the frequency can be reduced.
frequency can be reduced. Okay. Anne Maria,
So mostly I will ask how, or if we take the medication for how long it will affect the baby, like for the first trimester or for the second or third, is it affecting the baby more? Then I'll use it up to that, like that.
okay.
Then I'll.
Anjuvarki, okay, okay, good. Anjuvarki, Amal,
No, sir.
okay. So your predictions were correct. So when we have no choice, usually we go for the no drug situation, correct? We all agree with that. In case if you come across, then you have two options. That is why they're classified as high risk teratogens and moderate risk teratogens. Okay, let us understand what is this high risk teratogens. High risk teratogenic drugs are thalidomide, isotretinoin. Moderate risk teratogens are drugs such as phenytoin, carbamazepine, and valproic. These are the examples. Now, when we want to call them as a moderate or high risk, now let us see high risk teratogen means to say that when they are taken, at least 25% of the exposed population do suffer from birth defect here. Out of 100, 25 women definitely is going to have teratogenic effect. They are called as high risk teratogens. Whereas moderate risk teratogen here, 0.1 to 1% of the exposed population is likely to suffer from birth defect. So when you have alternative, my question was that what if another alternative also has the effect? Then the possible answer is that either you decrease the frequency and see what best you can avoid the drug, or if you take it also, the chances of 0.1 to 1% only will be there, but that you do not know whether you belong to the 0.1 to 1% population. That is also there, correct? So it is always wise to make such clarification whether what type of drugs they are and what to do. See, we all know that such situation doesn't come. All women are so much careful enough not to plan the pregnancy like that. If the pregnancy happens, that emotionally they are attached, and it is very difficult to make them to come out from that. And also at the same time their life will be in danger also. Both are at risk. Mother is also, pregnant woman is also at risk, as well as growing fetus is also under risk, because we know that phenytoin, carbamazepine, valproic acid drugs, such drugs do have anti-convergent effect, and if the pregnant woman do not take it, she may experience the convulsion at any given point of time during the pregnancy. But if she stop taking the medicine, then the problem will not be there for the fetus, but she may experience the convulsion. If she continues to take the medication and become pregnant, then her growing fetus will get the birth defect. So some of the approaches should be very, very carefully used, but the pharmacoepidemiology helps to take a decision, informed decision, when such kind of drugs are used, by analyzing the birth defect caused due to these drugs on a large population. That is why a large database is created, so that the information is fed into the large database on say 1,000, 10,000, 1 lakh people, so that you'll come to know what is the probability of the adverse effect. This is the one situation where when the drug is known to be teratogen. Let us go to the another situation where, now for this the approaches can be probably prohibit the sale of the drug. Then manufacturer should put a label saying that these drugs are likely to cause adverse effect on the growing fetus, and also you can educate physicians and patients about the teratogenicity, and also provide the restricted access to the drug. But in all the cases, the informed decision should be taken by the pregnant woman only. It is not that physician doesn't know, but pregnant woman should take the informed decision. In 1998, thalidomide was approved for skin symptoms such as erythema nodosum, leprosum. So at that time, what they have done is that they used steps approach, that is system for thalidomide education and prescribing safety. So where the education about thalidomide teratogenicity is given to the pregnant woman. Even you see here, the situation is that it was recommended for skin symptoms, to prevent skin symptoms. So they are equally afraid that through the skin, the drug is absorbed and reaches the system and can cause the malformations of the growing fetus. So first approach is that they have provided the education to the pregnant woman as well as the treating physician about its teratogenicity, even though it is approved for local usage. Then such medicines are available with registered physicians or pharmacies shops. In abroad countries, there are certain pharmacy shops and physicians who are registered to use some special drugs like this. Not all physicians can use. Then after the medicines are prescribed, then there is a need to monitor all the patients for the birth defect or any other related issues related to birth. This should be followed actually. Is known as a system for thalidomide education and prescribing safety. So sometimes you can use the drug provided you take the informed situation because of the emotional attachment, but information decision is very essential, and in such cases proper prescribing or monitoring system should be established. Otherwise growing fetus is likely to experience the birth defect. So these are the problems associated when the drug is known to be teratogen. And pharmacoepidemiology helps to understand by creating a large database that what is the probability of occurrence when such kind of measures are used. Okay, this is clear. Anybody has any doubt? Next approach is that when the when the drugs for which teratogenic risk is unknown. Earlier case was that when the drugs whose teratogenic ability is known, but here the risk is unknown, for which it is teratogenic risk is unknown, or ability is unknown. So in this case, either OTC medication or VAST medications do not have any label about the restricted use in pregnancy, because there is no evidence available. In such cases, the label is changed. Label is always put avoid unnecessary use during the pregnancy period, or consult a physician while using in pregnancy. So in such case, giving the right information to pregnant woman always help. Whatever the information which is available as on that particular day can be given to woman, so that she can take proper precautions to either avoid pregnancy or avoid taking the medicines. But physician is the person who can help to give the informed decision. Here there is a role of pharmacist in order to gather the information about its ability to cause teratogenic effect. Providing right information to doctor really helps for him or her to educate the pregnant woman whether she can take the drug when the teratogenic effect or teratogenic risk or ability is not known, right? So here also the pharmacoepidemiology helps to document how many cases such medicines are given, pregnant women such medicines are given, and what was the probability of their effect on the growing fetus. So that is the use of pharmacoepidemiology in such cases also, right? I hope this is clear. Right. So I will stop at this particular point because other things like has got a lot of things to discuss. Any doubt? Anybody? Okay, if there is no doubt, Manoj is there today.
He's absent,
Manoj
sir.
is there. Sorry,
Manoj is absent, sir.
Manoj is absent too. Can somebody give me the absentee list?
Yes, sir. I will forward it.
Who is this speaking?
Kessia Kurian.
Kessia Kurian. Okay, Kessia, please forward me the list of absentees. Okay.
Okay,
Thank you.
sir.
Thank you.